In the carnivore, specifically in the carnivore space, I tend to see people that the triglycerides will go down to less than 100, and that's ideal. HDL will go up, but certain people, their LDL keeps going up. And so I've asked this to other cardiologists in the space, but just curious your thoughts. Do you think there's a certain point where LDL can be too high? For example, there's some people where their LDL may be above 800, maybe 1,000. HDL then even goes up above 150, 180. Is there a certain point where, yes, it's not the normal cholesterol, but should we be worried with these higher numbers?
It's a good question. I'm not worried, okay. But then, so there's no LDL number historically that we would teach that you have to hospitalize someone. In fact, I've been searching for this. There's no immediate acute, meaning urgent life or death thing. There is for triglyceride. So if your triglyceride are 2,000, 5,000, 10,000, you'll be put in the hospital and fasted so you don't get pancreatitis. And pancreatitis is an urgent, life-threatening condition. Right. And so just all of every medical knowledge that we've known, there's never been a level where you'd have to hospitalize someone. Now, the kind of index case, and I go over this in the cholesterol course, the little girl with familial hyperlipidemia had an LDL of about 800. And this was way higher than the 200, 300, 400. And many of these people are in the cholesterol code related Facebook group called Lean Mass Hyperresponder. That little girl had atherosclerosis and heart attacks like at age 3. So I'm not worried about it. Now that I know what LDL does, it's good. It's a good thing. It carries around fat soluble things in your water soluble bloodstream. It's not there to cause heart attacks. I'm pretty convinced. Even the elite athletes that have been studied will have higher LDLs than thought to be optimal. But that said, I'm open to the possibility that it's bad. And I've done everything I can to help Dave Feldman with his study at citizensciencefoundation.org, where they're actually flying people to LA to a super good CT angiogram program. And they're monitoring people now with high LDLs over time in a systematic way. And there's specific criteria to see if you can get into that study. But there's a lot of other circumstantial evidence that suggests this might actually be good and not be harmful. So, and it reminds me 20 years ago when people said, you can't cut carbs out of people's food, they'll die. I said, well, that didn't happen. Right. Of course, I cheated. I went to visit doctors who had used this for 30 years in their clinical practice. I mean, I didn't cheat. So I used all of the information available to me at the time. And I would be careful if a doctor, outright dismisses your high LDL as bad and you have to be on a drug. You want a doctor that thinks about it a little more carefully. And I mean, health professional, not just physicians, but because we don't know. And it's very possible an elevated LDL is actually better.